So our first panelist is Gabrielle Cotton. He's a digital health specialist at the World Bank. He provides teams and country clients strategic inputs and technical assistance in digital health strategy, systems and solution implementation. He's also engaged in digital health capacity building, supports the digital health prioritization and strategy through digital health assessments. He has a vast experience in the health industry with specific focus on artificial intelligence and process automation in health. He obtained his master's degree in public health from the Hebrew University of Jerusalem and also has a degree in economics from the ORT University Uruguay. From his various high-level placements, he's had various opportunity to still work and develop innovative health solutions, and he's presented his work in various countries, and we are privileged to have him with us here today. Our second panelist is Thomas Wilkinson. He's a senior economist at the World Bank, previously a senior lecturer at University of Cape Town within the Health Economics Unit. In his various roles, he's been a lead on research and providing technical assistance on projects aimed at strengthening priority setting and health technology assessment in sub-Saharan Africa. He holds a bachelor's degree in pharmacy from the University of Otago and a Master of Science in Health Economics from the University of York. So Gabrielle and Thomas, we are delighted to have you, and I think I can open the floor for the presentation.
Thank you very much for this invitation. We are really pleased to join this important conference. So the health system around the globe, I think health systems are facing multiple challenges. We know these challenges go across health systems, clients, patients, administrators, providers. Healthcare challenge in terms of infrastructure, burden of diseases, limited access to healthcare services, lack of qualified resources, like in human resources, like in financial resources, and so on. But the pandemic has really further challenges and added new challenges to the current pack of challenges that healthcare system are facing, and they have pressured the healthcare system, and they ask for new innovative solutions, and there's where digital health can be a solution to overcome this challenge. And the important thing is that we don't need to see digital health as for the sake of doing digital health, but as an enabler for a transformation in the primary healthcare services, in the way we deliver services. We really would like to see a healthcare system that is dynamic, responsive, coordinated, efficient, accessible, but also innovative and personalized, that provides the healthcare service that each person needs according to their needs. The problem when implementing digital health, and that will bring the topic of my presentation on the assessment, is that there are a lot of challenges still in the space of digital health and implementing digital health, especially in low and middle income countries. There is a lot for space for leapfrogging, as government and people, they don't have too much experience in digital health yet, or it's not widely implemented. Let's say there are very nice examples in Africa of countries that are implementing and moving really fast, but still there is this space for leapfrogging and learn a lot on how to implement these technologies. We are seeing an explosion of pilots, what was called pilot cities. So, but we need to start thinking about how can we operationalize these digital health solutions to more sustainable interventions in the long term. There is a lack of data. Digital health interventions, they are really based on data, not only on data, on good quality data. And we're still having a lot of challenge in collecting data, in checking the quality. And important to mention, garbage in, garbage out. That means that if the data that we are collecting is not good, so our decisions will not be good as well. We need more frameworks The problem with technology is that it goes very fast, and the pace of regulation, it doesn't go in the same pace of those technologies. So we need to think, how can we really build these frameworks to protect the privacy, security, to protect the data, to really regulate, to protect the patients when implementing technologies. And the lack of evidence, which my colleague Tommy will talk afterwards, the importance of understand what works and what doesn't work, so we can understand where to invest our efforts, time, and money. So how can we start solving these challenges? Is first of all, trying to understand the context first. We need to focus our efforts on the problem, and not in the technology. Generally, we really focus on the technology to bring some more innovative ways to do things, but sometimes they do not answer to the challenges, to the problems that the healthcare sector is facing. Therefore, our recommendations really to, first of all, understand the context, identify the problems, and thereafter consider the technology. And this consideration of the technology should take into account the maturity of the country in digital health, the regulatory policy environment, safety, security, and privacy, evidence of impact, and so on. So the first step to understand the context and understanding the challenges is conducting assessments. Assessments are an amazing tool to really measure the ability of a country, of an organization, to really see where it stands and where it wants to go. It's a tool to understand the strength, weaknesses, opportunities, and threats. And understanding the maturity level, we can set up the next level of maturity that we want to reach. In this sense, the World Bank understands that when we do assessments in digital health, we need to look at various, at many areas. In the past, when we're talking about e-health, electronic health, most of our efforts were focused on the architecture and data maturity or infrastructure. But now with the development of big data, cognitive solutions, the amount of data that we're collecting, the power of analytics should be really not be underestimated. We really need to check what we're doing with data, for which purposes. We want to move from a descriptive utilization of data to more intelligent use of that data to predict, to understand, to infer. And as well, the applications, the interfaces with the clients, with the patients, with the health facility, with the community healthcare workers, those applications need to be human-centered and really need to answer the needs of the final user. So therefore, that level of digital health is also important to understand. And overall, obviously, understand what is going on digital ecosystem and governance that provides the enablers for a good implementation. In this sense, the World Bank has created a digital health framework that uses many indicators from existing assessments. So we are collaborating, and we're not creating a new tool, new assessment. We are just pulling indicators from different assessment tools in a big spreadsheet that allows to customize the assessment for the needs of the country to understand where are the gaps. But those assessments are only a first step. We want to use assessments as an input to prioritize digital health interventions, something that is lacking sometimes. Just, let's implement. No, let's first of all prioritize, base it something in impact on evidence. And thereafter, let's move to implementation. Let's stop thinking about pilots. Let's thinking about quick wins. How can we really implement and scale, and implement and scale and learn, assess, implement and scale again? One of the most important things when prioritizing digital health interventions is really focusing on the low-hanging fruit principles, those things that will bring large impact in a short time. We're very focused sometimes on this conversation of AI, of artificial intelligence, and that's okay. Probably that's the future. But we understand the adaptability of these technologies. Sometimes we are bringing examples that they really don't answer to the needs, and they don't adapt to the maturity of countries. Countries should start humble, should start with small implementations that thereafter can be scale up, adding. So again, it's changing this mind from a pilot to quick wins. Quick wins are really implementing a project, but in a very small scale. Thereafter, you just add more components to it. One is secure. And this implementation should follow, I think, these criteria that you see in the screen. They should be easy to use, and this is based on that principle of the low-hanging fruit and then the quick wins. They should be easy to use, collect minimal data so we can generate trust. Once interventions are taking more data than is needed, users don't trust the system because they ask why you are getting this data for. Rapid implementation. We are in a moment that we are so stressed that we need solutions, so they need to be rapid to implement and not very complex. Protect the security and privacy of data. This is very important, especially with the amount of cybersecurity attacks that have been occurring since COVID. This should be flexible and easy to scale up. And this is a relevant aspect because COVID will be done, hopefully very soon. But what is the next thing? So these systems that we are investing, they should also answer to the next pandemic, to the next event, or the current burden of disease going on in countries. Allow continuity of care. We want interventions that provide information to existing systems as well, so we can follow the patient in his journey. And they should be interoperable with existing systems. We don't want to remove what is already done. We want to make them to talk each other. And this is a very important aspect, especially in our countries where we are seeing a lot of vertical and duplication of efforts, vertical programs. They need to talk with each other so we can have a whole perspective of the patient journey. So with this, this last slide, I pass the presentation to my colleague, Tommy, that will talk about the evidence of digital health interventions. Thank you very much.
Great. Thanks so much.
Tommy, you tell me when to pass this slide.
Great. Thanks, Gabriel. Just checking you can hear me. I see my video has been disabled, so I can carry on, but I can start my video whenever that's allowed.
We hear you well, Tommy. We don't see you.
You hear me well? Okay, so I'll start, and then just let me know. Maybe let me know when the video is fine. I'll turn that on for you. And thanks, Gabriel, for that, for setting that us up and giving us a really neat and thorough overview of the context of where we are. The concept here of establishing value in the COVID-19 environment becomes really, really important. We saw that the initial response to COVID, both digital and non-digital, was really following this rule of rescue approach, or sort of an urgent response to a very urgent public health need. And therefore, we didn't see a huge amount of economic evaluation in determining the investments, digital and non-digital. There was really this policy priority to act quickly. But then as more data comes available, we'll begin to have the opportunity to say, okay, how are we going to invest? Not just the most effective thing that we can be doing in the digital space, but what's the most cost-effective thing? But the experience that we have is very limited around this concept of economic evaluation of digital health interventions. And so the thinking around some of the work we're doing is, how can we set up frameworks, how can we set up methodologies that enable us to do analysis to identify the right interventions, and that will give us the tools and evidence to leverage investments and roll out, and then facilitate implementation. All right, and there's my video. Okay, my video's come on board. That's great. So this is the question: how do we establish value of a digital health intervention to our health system and the health of our population? Now we know there's often a lot of hype around digital interventions. We know some of them represent extremely good investments, that they will have substantial health gains or health system efficiencies, and the scale up offer a really large potential. And not just in efficiency, but things such as equity and improving access and things. However, it's not all good news. We know that some digital health interventions are going to represent bad investments for a number of reasons. It might be that the conditions in which we did the sort of pilots and evaluation don't yield the expected health system impact at scale, or that the opportunity cost of the investment, so the amount of money we have to put down to achieve that digital health intervention, outweighs what we could have done elsewhere with that money in the digital or non-digital space. So we need these mechanisms and assessments and tools to answer this question of value, how much we need to invest to get those desired outcomes. And the traditional tool for that is economic evaluation. Next slide, please. So, but we want to build on existing guidance and classifications as well. So looking around what could be the right investments. There was a landmark publication from WHO, many will be familiar with it, on recommendations on some digital health interventions, came out in 2019. And really looking at these key outcomes of sort of effectiveness, acceptability, feasibility, resource use. So they're able to look at the evidence, the thorough evidence search and analysis, and say these are some of the digital health interventions that we think for health system strengthening that would be feasible. Next slide, please. However, the report itself would acknowledge that there was limited evidence on value for money in systems. They were able to make the recommendations based on broad understanding of the health impact and likely impact on the health systems. But when it came to this critical question of within the particular country, do these interventions that WHO are recommending, do they represent value for money? There was a limited body of evidence for that. So the question is, what can we do around enabling this evidence to be produced? Next slide, please. And so starting the first step in this process, we looked at the evidence base. So we've used what's called an evidence gap map for digital health interventions and AI. So the evidence gap map looks at it's a broad review of the literature and lays out what the existing literature that's published in the academic journals, what has been published and what the outcomes are. And it allows us to get an understanding of the field and see where are there gaps in terms of what outcomes are presented, and also what sort of technologies aren't having economic evaluation done on them. The next slide, please. And here is just a snapshot. Now, the useful thing about an evidence gap map is that you can be open about the outcomes that you're looking at. And so if we're looking at from the published literature, what is reported in economic evaluations. And remember, this is important, because if you're a decision maker and you're trying to take an evidence-based approach about where you're going to invest, or you're a funder and you're trying to see how we're going to support scale up, you're going to want to look at the evidence base. And we can see what the sort of evidence base and outcomes are being presented here. So you're getting some information on quality of care, healthcare utilization, some on client and provider satisfaction, but we're really quite interested in this idea of economic outcomes. So that's can we inform how much it's going to cost, and what is the opportunity cost of the investment? Next slide, please. But looking at it in a bit of a word art sort of snapshot as well, this is sort of interesting for us as well when we're looking at the main outcomes that are coming. So obviously we'd expect health to come out from the evidence base, and sort of adherence was a large outcome measure that was looked at. But you can see a real mix, and you can see a focus say on NCDs as well. So HbA1c is featuring, and some NCD type conditions as well. Now you can see the word costs in there, just slightly under health, but very small. So we know just from this visualization approach that the economic outcomes were quite low. Next slide, please. And now breaking down from that small proportion of studies we saw from the literature that were showing economic evaluation, only a few of these, so the majority are around cost or cost analysis. Now this is almost like the first step on the road to an economic evaluation, because it gives us an idea of how much the intervention will cost, so the unit cost, maybe some implementation costs, and sort of setup and training delivery. But it doesn't give us this really good understanding of how much, of the value. We can get, financially, how much we have to pay, so we can do our budget impact. But if we want to assess the economic benefits, what we really need is these ones on the lower down here. So these cost effectiveness analysis and cost utility analysis. So that's how much we know we have to pay to get a certain unit of health gain. So all that just to say that we know that the existing literature base is quite limited, especially compared to other types of interventions in the area. Next slide, please. And so if we want to have a look at what is the approach to representing value in economic evaluations, it's not as straightforward as a simple assessment. We know that value depends on whether you're an investor, a product developer, or a researcher. and they're wanting different things. They're asking different questions about what means value for a digital health intervention. But if we can get to a common ground between investors, product developers, and researchers at what constitutes value, then we can get to a common framework for determining how we're going to make these assessments, how we're going to communicate value. And when we think about this, it's in terms of, say, the clinical outcomes, and that's what we'd expect. So disease-free survival, cases averted, if you're keeping people out of hospital, and even things like DALY, so disability-adjusted life years. These are sort of these summary measures of health. But then it's not just health that digital health interventions are giving us value. There's a lot of process type outcomes, shorter wait times, administrative things, patient experience, and how a patient feels about the interventions. And then, of course, all that costs and cost offsets and opportunity costs. Next slide, please. So what that means is we've got a complex arrangement. If we compare the concept of economic evaluation of a digital health intervention, and we compare it to where it's more traditionally done, economic evaluation, say like for pharmaceuticals, then you've got a lot more complex base. And so this first step, what we tried to do is set up a framework. And it's a sort of a neat sort of standardized type framework, five quite simple steps, and building on a lot of the other economic evaluation sort of methodology that's out there at the moment. First and foremost is determining the context, and we know that the context in which you implement your digital health intervention can change the value proposition completely. And there's a lot of contextual issues, the infrastructure, the health system maturity, and everything else that goes towards that. So the first step is saying where are we wanting to implement this digital health intervention, and what is the nature of the context in which we want to implement it. Then there's this concept of intervention type. Now there's a lot of there's a definite need to be clear about how we're defining the intervention, and we can use the established WHO methodology, and also the presence of AI technologies, whether that's machine learning or some sort of predictive analytics, has a big impact on how we would want to carry out the economic evaluation. And the reason that's important is a big impact on the way evidence is used and produced. Then there's a step around the level of complexity. Some digital health interventions are quite straightforward, but some are sort of multi-component, multiple systems, multiple entry points in the pathway. And then there's your straightforward analytical principles. So how are you going to do comparators? What time frame are you going to do your analysis over? How are you going to measure costs and benefits? And then there's representing what we call the value proposition. And so we can do aggregation, put a lot of those things together, and do our best to have these summary metrics, and then also this idea of an impact inventory. So you're laying out what the benefits should be. The next slide, please. So this framework is in drafting an initial application phase. So we're running out some applications now to see how the framework will perform and make adjustments to it. And if we can apply it across a range of digital intervention types and so digital so decision spaces and contexts, that will give us a really nice understanding into the way that this performs and how useful it is to decision makers. It'll be critical to, as we roll this out, to continue to engage with a range of stakeholders. So that's everyone on this call and lots of other groups as well, to see how this is performing well. And then there's a little bit more work to be done on here as well. That the full representation of the health system impacts. We know they go beyond just immediate, and they become quite dynamic. This causal pathway between direct outcomes that we'll observe from a digital health intervention, and these concepts of usability and acceptability, and this very difficult to capture area of trust and privacy. Often these are represented sort of more qualitatively. But if there's methods to look at how quantitatively we can be a bit better about representing trust and privacy in our economic evaluations, that will even add to the depth of the analysis that we can perform. So I'll stop there, and we wanted to just give you that brief introduction to it and show you where we're at with that process, and we're hoping that in time we'll be able to use this framework to develop some really robust evidence base, which will help country governments, funders, product developers across the board in making these investments, and ultimately scale up the good interventions and identify where the interventions aren't likely to yield value for a health system. We can identify these early and save the bad investments. Over.
Presentation, You actually highlighted something that was mentioned in the morning about approaching it from an evidence-based, using the problem to innovate the technology and not the other way around. As I wait for questions in the chat box, for those in attendance, if you have any questions, kindly drop them in the Q&A. Let me go first and ask Gabrielle a question based on your experience in working with in the Sub-Saharan African region. What would be your comment on how prepared this region is in terms of starting to innovate their own technologies? And what has been your experience in the masses to whom the technology is rolled out in embracing, especially high-tech innovations?
Thank you for that question. I think let me share the screen again, and I want to show one slide. I think really this. Do you see the screen now? Sorry. So I think here, I think that slide answered to at least some of the countries that I'm working with in the Sub-Saharan Africa. There is a lot of space of leapfrogging, and that's also great news, I think, because other countries have already do a lot in digital health, and we can learn from those lessons. Because there is a lot of space for digitalizing, we can take that time and understand the lesson to do it correct. One of the things that we are seeing is it's a lot of duplicated efforts and vertical programs. So how can we connect with each other? How can we collaborate? And for that, it's very important that governments take ownership and take of the digital health strategy or the digital health agenda, not in a way of imposing, but in a way to coordinate efforts, to set the priorities, to really encourage impact evaluation, as Tommy was mentioned, to start prioritizing digital health interventions and not just put money where it is not going to give value. One other aspect is the lack of data, as we were mentioning. We need to improve the way we collect data. We need to improve the quality of data. We need to start to streamlining processes, making them more effective. And instead of thinking about AI, let's start thinking about very simple things about like automating process. Very simple. Let's start to think about how can we reduce some of the steps on those processes to make it more effective, but with more quality. I would just hear, some stories about multiple steps in checking the data, but you are just checking if the data clerk entered correctly the data, but you are not checking if the data that he's entered has been well collected. So maybe he just copied the data from a paper registry to a digital registry correctly, but maybe from the beginning the data is not correct, right? So we need to work a lot on quality of data, and the need from frameworks, and especially in the part of cybersecurity. Because some of the systems are not very digitalized, cyber attacks are less relevant, but moving into digital health, the aspect of cybersecurity is very relevant. And again, I think that the solution to really move fast is start thinking about think less on the technology and focus on the problem. As our team really try to spread this message of delivering health in a digital world and not digital health. It's just about really focusing on the problem, focusing on the challenges. I think there are great opportunities in our countries, great opportunities to implement very interesting interventions. But again, let's start small, let's start humble, let's focus on what really brings value on those low-hanging fruits. I hope that answered the question.
Yes, thank you. And we have a question from Dr. Ross.
Hi, thank you for the presentation. Unfortunately, I can't type because I'm a panelist somewhere. My question is about the framework that you're developing, the evaluation. Will there then, do you think that this will then lead to some kind of like value for money stamp or certificate, or some kind of official accreditation or something that will come out of your evaluation tool? Thank you.
Yeah, thanks. That's a great question, and I think what it'll mean is you'll get an accreditation or sort of a standard or a stamp for the process in which you, or the method in which you assessed the economic value of the intervention. I think it's quite clear that especially all health interventions, but especially digital health interventions, it's very difficult to give them an absolute stamp of approval. And because of this issue of context, one digital intervention could be a fabulous, the best investment made by the health system in one context, and it could be a miserable failure in another context and waste a huge amount of money just because of the contextual factors, just the issues associated with implementation. So I think what this is moving towards, this framework, is saying this is how you should do your assessment. This is a good standard and a framework, a common methodology for assessing economic value, and that'll apply to the assessment itself, but not to the technology. Yeah. It might be that, just to follow, it might be that, say, normative agencies, could be, say, WHO or others, may take these high quality economic evaluations to make sort of strong recommendations, or maybe a country level or even sort of regional level would say, look, we want to implement this, and this gives our mark of approval for this context. But it's a two-step type idea of getting good methodology first. That enables the normative agencies to be a bit more firm in their recommendations.
Thank you for that. As we wait for more questions, maybe I would ask, as you rightly pointed out, this technology involves a collection of large data sets, sensitive information. What would be your comment on how to possibly allay fears of data misuse and fortify security and confidentiality?
Thank you. I think it's to be transparent, right? It's there were cases on COVID that track and trace applications were used for other purposes. So when that happened, we are just reducing the confidence of the final user into these interventions. The first thing I think is understanding who is the final user, right? And then understanding their needs. So when we create a digital intervention that is human-centered or user-centered, so and the final user is not only a patient, could be a healthcare worker, a community healthcare worker, a health facility, the national level, right? So when we first of all have this human-centered design, so we are trying to assure that the final user, we use the intervention accordingly. So that's first step. But second, to be transparent, to really disclose why we are using this data. There are different modalities also for data sharing. There is opt-in or opt-out. You can give the final user the option to, do you want to share your data? Or you can also give the option to remove his data from the intervention. But this need to be clear. This need to be clear. Also, when there is a lot of discussions to moving into the cloud, especially because of the security of data in terms of reliability of data hosting servers, in terms of communication and connectivity and electricity problems, right? So we want to move to the cloud in terms of securing the data and securing the continuities of data. But when we move to the cloud, we also need to conduct assessment to understand what data can be moved to the cloud, in which way, which technologies need to be used. And most important, legal frameworks. We need regulation. Sometimes we move so fast in technology that we are, regulation is just very behind of that. And this, I was talking with my colleagues, we are in the same position than 20 years ago. 20 years ago, we were talking about regulation on ICT. or e-health. Now we are talking about regulation on AI. What happened that we don't move fast on the regulation? Why we first of all implement and after we think about all these things? And what happened is that really you are reducing the confidence. And what, again, we want to send a message that digital health can provide a better answer to the healthcare challenges, and really have this final user to use this tool. The less that you want is just you invest money in a digital health intervention, nobody's going to use it. And there are many examples of that, both in developing and developed countries. There are amazing examples of great EMRs have been built, electronic medical records, that nobody uses it because it doesn't answer the needs, or it's very complex. So again, and sorry, one more element. When you are designing those, include the final user in the design. Not only think about the final user, include them in the design. Over. Thanks.
Thank you for that response. I think one final question would be, at the height of embracing this technology, specific focus to artificial intelligence, do you see any possible trade-offs in terms of clinical training or clinical practice?
Can you repeat that question? I'm sorry. If you can clarify.
The question is, when at the height of fully implementing artificial intelligence into health systems strengthening and management, do you foresee any kind of trade-offs, especially in terms of clinical training, clinical management? I give this using the example of, say, for example, we have, there is development of artificial intelligence to take over certain procedures, say, for example, coronary heart surgery. So in the foreseeable future, would that have any trade-offs in terms of clinical practice, training, incentive to join the medical fraternity?
Okay, Tommy, do you want to answer that question?
Yeah, I can come in, and so it's sort of a bit beyond the the concept of sort of the framework and things, but definitely there's that concern that the more you automate, you take that human element out of it, and whether that there's that nuance, that special sauce involved in sort of the human response that will enable that the ability to